it to go on my field trip because no one was trained for the epilepsy the medicine that I needed for my epilepsy, and that I hope we could get some money to look for a cure and to help make medicines that don't have as many side effects.
Okay. I think these are all there, but
and we also have
yeah, you would.
we have a corporate hearing.
Hey there.
I think these are all there, but
And we also have
yeah, you would.
we have a corporate hearing.
Hey there.
Here, all I do is call and you want your bag. I think these are all there, but
And we also have
yeah, you would.
we have a corporate hearing.
Hey there.
Medicare, CMS has the data now. I mean, in order to do the studies, it's just somebody needs to get those studies done. If you need a medication and you need a prior auth, they have to get that to you basically within 48 hours, get that done. So the idea that they can't do this in a reasonable period of time, there's no data.
I'm Joy Wilson. I'm the Health Policy Director at the National Conference of State Legislatures. There are things that each individual can do in working with their local state legislator, their member in that district, or going to the legislature and participating in activities, as well as working with the National Congress in terms of moving forward your agenda on epilepsy.
My name is Molly Voris. I am a Senior Policy Analyst at the National Governors Association Center for Best Practices. I think that the real issue moving forward with state health reform for the Epilepsy Foundation and the epilepsy community is to really build coalitions with other organizations in those dealing with chronic conditions.
I'm Catherine Guccione. I'm Manager of Public Policy and Public Relations for Women in Government. And we've been working on the topic of epilepsy for a couple of months now, and we're very excited to be working in a partnership with the National Foundation.
I'm Eric Hargis. I'm the President and CEO of the Epilepsy Foundation. Public policy is an extremely important initiative. It's an opportunity for the epilepsy community to literally put a human face on epilepsy for our representatives, our senators, to make sure that our legislators understand the issues that affect people with epilepsy. Very important is the Kids Speak Up initiative. Not only is this an opportunity for young people to learn about and participate in the educational process, but I have to say the stories are so compelling. You know, it's very, very difficult for a representative in a tough budget year to look across the table at a young boy or a young girl who's having uncontrolled seizures, you know, epilepsy is affecting them 24/7, and say, you know, I'm sorry, we just can't help you.
Well, my name is Katie Thompson and I am 17 years old. I was diagnosed when I was 12 and I've had it. It's been awful and great and everything, I reckon you could say.
My name is Bob Bussey. I'm from Milwaukee, Wisconsin, and I'm not ashamed of epilepsy because it's good to be different.
My name is Austin Christoph, and I started having seizures at age 6. I had the staring spells at age 6, and then when I turned 12, I started having the tonic-clonic seizures, which are the big seizures where fall and start shaking.
My name is Tyler Frohrit. I have had epilepsy since I was born. I still have epilepsy. My epilepsy is in my brain. I wasn't able to have surgery, so I've been able to take pills for it.
The Kids Speak Up is a great way to really bring home the story about what it's like to live with epilepsy.
I always miss on all the fun with my, if I'm playing with my friends games or something, if I have a seizure, I'm missing out on something, or even like somebody's birthday, I miss out on something.
We have a good support network going.
Support.
Our whole family is very supportive of everything that she goes through, and listen to her needs also. You can see the frustration in her face when she comes out of a seizure, not being able to remember that time that she lost.
Well, we've been having the Public Policy Institute now for more than 10 years, you know, and when this started, there was not one federal program for people with epilepsy. If you can imagine 3 million Americans, not one public health program to benefit this community. Now, although it's still fledgling, we have a great program with the Centers for Disease Control and Prevention. In this last budget, there was $8 million for public health programs to help people with epilepsy. There's also a program with HRSA, which is the Health Resource Services Administration, and this initiative is to help early diagnosis and appropriate care for children, particularly in underserved communities.
Grab the top, grab where my hand is. Yeah!
I'm not ashamed of epilepsy because that's what we're going to start talking about tomorrow as well. We're going to start doing some activities, preparing for our day on Capitol Hill, which is why we're all here, right?
You know, advocacy is an extremely important initiative for the Epilepsy Foundation. We're not actually the advocate. The advocate is people with epilepsy speaking up and speaking out about their issues and their condition. So what we do is facilitate that process. We have, through our website, people can sign up to be part of the Speak Up, Speak Out network. The only obligation for signing up is to say, you know, I'm willing to let my voice be heard. I'm willing to call or write letters or send emails, but basically making sure that our legislators understand the issues that are important to me. We have over 10,000 people who have signed up for the network.
My name is Linda Wallace, and I'm Executive Director of the Epilepsy Foundation of Connecticut. The families are going to be asking for an increase in funding for epilepsy services through the Centers for Disease Control. They're also going to ask that the ADA, the Americans with Disability Act, be restored so that it will help people with epilepsy the way it was intended to. It's kind of eroded over the years through the court system, so we're going to be asking for that.
She falls asleep from the medicines and from the seizures. Right? Scooch over here. Yeah, are you saying that? Yes, I am. Which would cover these programs. But tell me about the ADA. The important was that there also is an emergency, you know, could have an attack at any time if they smell peanuts or something like that. So that's just one example.
It goes to our national office, but we do get funding to do those programs and other educational programs.
She's the executive director.
And where are you based?
In Middletown, as they say.
And I'm a detective in West Hampton.
Okay.
As they grow and they get big, you know, the medicines change, and sometimes the medicine stops working, and we have to try new medicines.
Right. Are there other Connecticut people here today?
We're meeting with the two senators.
Okay.
Yeah.
Okay. Great. And have you met with either of them yet?
We're heading over there
right now.
Okay.
$8 million seems like a lot of money until you start talking about the federal budget. There are programs where they lose that much just rounding off in the various categories. We need to increase the program at the CDC. We need to increase the program at HRSA. Particularly, we need more money for research. We need to make sure that the extent and the breadth of the problem of epilepsy is recognized in the federal budget.